Today's webinar is entitled Technology and Health 2.0. Your presenter is Kelly Ham. Kelly is the Consumer Health Coordinator for the National Libraries of Medicine, Pacific Southwest region. Kelly helps libraries and community organizations provide quality health information services to the public. Kelly develops presentations and training materials with a focus on health literacy, new technologies for delivery of health information, and services to special populations. I'm now happy to introduce Kelly Ham.
Hi everyone, and thank you for attending this webinar. It's good to be back with InfoPeople again. So our talk today is going to focus on mobile technologies and the ways that people are using social networking sites for sharing health information. So our objectives are to help you by the end of this webinar be aware of different types of mobile devices, to understand those differences, what is an app and what is a mobile site. You will be knowledgeable of the types of mobile health and wellness resources that are authoritative, quality, and reliable resources. You'll also be familiar with how patrons and consumers are using social networking sites for health information. So our agenda will be to start out with just some introductory material about what we'll find in the mobile universe, the devices that are being used right now, apps, the different kinds of content that you'll find for health information, and fitness and wellness and all of that. We'll look at these resources, not only the authoritative government sites, but also the commercial sites and ones that are available for a fee or for free. We will evaluate those resources, and you'll have a way of helping your patrons and library users use the mobile apps as an adjunct to some of the things that you provide right in the library. So many of you are familiar with the Consumer Health Toolkit. This was a project that was in partnership with the California State Library last year, and the toolkit is a PDF file. It's 93 pages, but it contains a wealth of information. And one of the sections within the toolkit, this is the Finding Health and Wellness at the Library, a Consumer Health Toolkit for library staff. One of the sections is called Technology and Health 2.0, and that provided the basis for this webinar. So when you get a chance, if you don't have a copy of this PDF, be sure to download it at this URL and save a copy on your computer. It is packed full of good information for all library staff as they provide consumer health information services in the library. So we need to start out with some definitions of what we're going to talk about today and the things we're not going to talk about. So when I refer to a mobile device, I'm talking about those things that people carry around, their smartphones, their tablet computers, iPads, iTouches. In some cases, people still have PDAs, the personal digital assistants of yesteryear, but some people are still using them. So those are what we mean when we say a mobile device. You may have heard the term mobile medical device or mHealth, and for the purposes of today's conversation, that refers to the devices and systems that are used by healthcare professionals and medical personnel to do something for the patient or with the patient. So it's gathering, transmitting, or analyzing information. It might be some sort of a remote setup in a clinic somewhere that's sending information to a hospital in an urban area, those kinds of things. So we're not going to be talking about those types of devices and systems today. A mobile app. An app is a piece of software that is downloaded to a device that allows the user to do something with it, either input data, receive information. There are a number of things that can be done with these mobile apps, but it is software that is downloaded to a device. A mobile site, on the other hand, is actually a website available through the internet. And the difference between a mobile site and a regular site, as you might imagine, the website content is usually stripped down a little bit, and it's optimized for display on a small screen. And so you will never see the full website with all of the graphics and the fancy animations and things, but you will see more basic, important content on the mobile site. So now I'd like to find out, just from all of the people who are in attendance, most of us have some sort of device that we carry around. So I'd like to open up a poll and actually find out what you're carrying around in your pocket or in your briefcase. So I'm going to open up the poll here in just 1 second. And I'd like you to indicate on the poll what type of device you have. And then in a few minutes, we'll go ahead and close the poll and see what people have and the ones that they're using. If you have more than one, go ahead and choose all of the ones that you use. One thing I didn't mention was that it could be an e-reader. If you notice on the list, we have Kindle, Nook, or other type of e-reader. And then in some cases, some of you may not own any mobile devices yet. Okay, it looks like we are getting quite a few results now. I'm going to close this in just another minute or so. Okay, I'll be closing this, and then we'll take a look at what we have another few seconds while people can finish up with their responses. And then I'll share the results with you here in just a little bit. Okay, so what we have then are, let's see, it looks like the majority of people have an iPad. Many of you have iPhones and Android phones, iTouches. It kind of covers the whole gamut. I do see a few of you still have PDAs and a few of you have tablet devices. But interestingly enough, we have 12 that don't own a mobile device. And I'm wondering if that's just the way it is right now, or if you're not really interested in having any kind of device. But anyway, that's a great example. So thank you all for participating in that poll. Now I'd like to talk a little bit about the trends of how people are using mobile devices for health information. I mean, we use them for all kinds of things, for entertainment, as ways to find answers to reference questions for ourselves, possibly for library users. But for health information, there is definitely a growing trend, and there have been research studies that have been published on this phenomena. It is definitely growing, and among certain populations in particular, African American men and Hispanics in general are the user groups that have the highest adoption of using mobile devices for health information. And following on that, some users are completely skipping the computer to use the internet. For certain population groups who either didn't have access to computers, didn't know how to use them, other kinds of reasons why they didn't use the internet. Now they have a smartphone that has access to the internet. So many users are learning how to use the internet and searching for the very first time on their phones. And that's kind of a surprising development. But I guess we shouldn't be surprised. It makes sense if you think about how common cell phones and smartphones are now. So the final point here is that if there's an application, often there's a mobile site or a website that complements it. So in some cases, the website came first, and then apps were developed, or mobile sites were developed after the fact, so that people can access them no matter what type of device they use or prefer. So just a few questions for you to think about. And if you would like to, you don't have to do this, but if you're interested in doing this, you're welcome to put an answer in the chat box for any or all of these questions. So in your own library setting, are your users using mobile devices to access either library materials or reference content? In some cases, you might have access to e-books and things like that. Or they may be going directly to your library website. If you have a mobile version of your library website, I'd love to see a mention of that in the chat box. So e-readers, are people using e-readers to access library content or just in general? And do you see changes in the library services due to the use of these devices? My guess is that yes, we are going to see changes as we go forward, but I'm not sure how fast that's going to happen. It'd be interesting to hear your comments. Okay. So finding quality health applications and mobile sites of interest to library users. How do you do that? I have a quick list here and we'll look at these in more detail. The National Library of Medicine has a directory of all the apps and sites that they have created and are making available. There are other government sites that are producing this kind of mobile content. The CDC has and I don't remember now if it's an app or a mobile site, but I know that the CDC has some mobile content. The Veterans Administration has produced a really nice tool that I'll show you later. And there is a directory of apps and sites at USA.gov. There are other thousands, maybe more, of non-government, what I'll call commercial offerings, ones that are outside of the realm of what I generally will talk about. And before I go to the next slide, I just want to look in the chat box and see what some of the people are responding. So we do have e-readers, and it makes sense that around Christmas time, a lot of people are going to be receiving these as gifts and then starting to use them. So, we're going into the holiday season again, and I have a feeling there will be another surge, especially now with what's happening in the e-reader marketplace, because the price points have really dropped, for some of these devices. And then we have the question going back to that prior slide. We have answers yes, yes, and maybe. So the maybe, do you see changes in library services? So possibly yes. And we have someone who has just debuted a mobile website and mobile catalog. That's wonderful, Lee. I'll have to take a look at that, and or at least check in with you to see how it is used later on. And also we have others that have a mobile website for main website and for Overdrive. So that's really great. Thank you so much for responding to that. So this is a screenshot of the National Library of Medicine directory. It's called the Gallery of Mobile Apps and Sites, and the URL is right there on the screen. If you don't remember this URL and you want to quickly get there, then you can always just do a Google search, NLM Gallery, and it should pop right up. National Library of Medicine Gallery or mobile, and it will definitely pop right up. Because the NLM URLs are not user-friendly, as you can see. But anyway, that's another story. So on this page, I'm only showing you the top 4 that have popped up, but there are many, many others on this page. So when you have a chance, go to this page and just explore a little bit. What you're seeing on the page here, I'll be talking about 3 of them, but the 4th one, the Daily Med, is one I don't have screenshots for, but I do want to point out that this is a mobile site for the prescription inserts, those big, long, hard-to-read inserts. And this particular content is so easy to use. If you or one of your library users needed quick information from those drug inserts, basically they go to the Daily Med site, and there's a website for it too, the Daily Med website, and then it breaks it into those sections so you can very quickly go to the precautions section or the side effects section. It's a very nice service. So just something to be aware of. And within that NLM gallery, we have all kinds of content. It is broken down into 3 types of audiences: emergency responders, health professionals, and consumers. And there is a little bit of overlap. And so I'll be showing you examples of some of these here in a minute, but this is just kind of an example of what's there right now and how the breakdown is by target audience. So the first one I want to mention, any of you who've listened to one of my webinars in the past knows that I'm a big advocate for medlineplus.gov. It is one of the best places to start for health information for consumers, patients, caregivers, and even health professionals as they need to recommend materials for their patients. So as librarians, you really need to know about medlineplus.gov as a great resource. Now there is Medline Plus Mobile, and it's very easy to use. It does have the drug database, all of the health topics, and then current health news and some of the material from the encyclopedia, the images and so forth. It's a great site, and this is a mobile site, so it's not an app that you download. If you have access to the internet on your phone, you have access to Medline Plus. So check that out when you get a chance. Now I'm seeing some other things in the chat box. You've probably all read this too, but some folks are saying yes, they do have mobile sites, lots of e-books, and and Howard County has been loaning out Nooks since last winter, and 400 plus holds for them. I know this is really a trend and a change in a service model, and what a wonderful service. I wish I lived in Howard County, but anyway, maybe my county will eventually do that too. It's a great thing to hear how people are changing with these different technology advances and how they're just embracing it. I know there are challenges with it too, but it's good to see. So the next one that I'll show you, this is an app that's downloadable, and it was intended for health professionals originally, but this is a glossary that has all kinds of terms related to HIV/AIDS, and it comes from the AIDS Info website. Now, the handout that I've provided includes a little more than what I'm showing in the slides. In the handout, we have the full website for AIDS Info. So if you are ever in a position to provide, reference services to someone who's looking for information about HIV/AIDS, you need to know about AIDS Info. It's an excellent site. And there are there's a mobile site for AIDS Info, the whole website, but there's also this glossary app, and it is available in English and Spanish. And it's kind of like going to Vegas, because as you see the way this app is designed, you have the little ABC listing on the left, and when you scroll on that with your finger, it goes just like if you were on a slot machine in Vegas. And so you choose the letter that you want, and then the right-hand side is also that way. So you just scroll it with your finger, and it rotates around, and so pretty soon you hit the jackpot and you find exactly the term that you want. So it's very well designed. I've seen this style in a lot of other apps too, so it's just a really nice way of allowing you to get to the information you need very quickly. Now, this is an app that the National Library of Medicine has some really interesting collections and displays, and this particular one came from a project that they had. This one is called the Embryo app, the visual exploration of human embryo development. And so they have put together all of these resources into an iPhone app. And it also works on the iPad, but some of the content looks a little bit different on the iPad. But you can see here that you have really nice images that are labeled, and then over on the left in the table of contents, there's a pregnancy calculator and all kinds of other resources. So that's a good one in case you need a resource like this. Now, the next one from the National Library of Medicine, some of you may be familiar with DIRLINE. It's the Directory of Online Health Organizations, and it's a very extensive directory with a really good search engine. So if you're looking for some obscure type of research organization about a particular rare disease, you can usually find something using DIRLINE. Now, Health Hotlines is a publication that is a subset of DIRLINE, and it just includes the health organizations that have 800 numbers. So it's a really nice way of just providing the contact information by these organizations that have 800 numbers. And you notice on the menu, you can look A to Z if you know the name of the organization, or you can sort by subject or by state. So if you were looking just for local, state organizations, you can do it that way too. But on this slide, I did include the full URL for DERline because that's a good one to know. It's a good thing to put in your librarian's toolkit to have as a resource in case you need one of those odd or even not so odd, maybe a major health organization. So now we'll switch gears a little bit and talk about resources that can help in an emergency and a disaster. One that I'll show you is really relevant to libraries in particular, and then a couple of the other ones are more for the emergency responders. But I do want to show those to you just so you know that they're available if you ever have a need for them. So this first one it's a mobile site and also a website. There is not an app for this, but the full website is very extensive. And what it is a site for any kind of emergency problems, and in particular water emergencies that might happen in a library. And some of you may have heard, I heard a story about the state library, I believe it was. There was a weekend incident where something accidentally fell off the wall and hit a faucet, and then the sink was plugged somehow, and then there was water everywhere and it happened, of course, on a 3-day weekend. There was a holiday, and so there was an unexpected flood or water damage, and it was on the second floor. I might be getting some of the details wrong here, but what would happen if you came in on a Tuesday morning after a long weekend and you found this kind of condition and just pools of water everywhere that had damaged some of your collection? Well, what you would do would be to pull up this emergency response website, and it would walk you through step by step with videos in some case of what to do based on the type of material, what the damage is, how to do a very quick response, and then preserve the things so that you can take care of them later, that sort of thing. So this is a really good one for you to know about. And again, all of these that I'm showing right now are available in that NLM gallery of mobile apps and sites. The URL for this is in your handout. And also I see that Eileen is putting them in the chat box, so thank you so much, Eileen. That's very helpful. So the next two resources really are more of interest to health professionals, nursing students, medical students. Occasionally you may have need for searching PubMed, but I'm just showing you these two resources so that you're aware that they're available. PubMed.gov is the resource that allows people to search Medline. Medline is the database of clinical journal articles for health professionals and researchers. So if you hear us talk about Medline or Medline Plus, they're two very distinct things. Medline is the clinical literature. MedlinePlus.gov is the health information website for consumers, patients, and your library users. So PubMed is basically the interface for Medline. And then these two are both mobile resources that the health professionals and others can use to access this clinical literature. And this one, the Radiation Emergency app, it's REM, which stands for Radiation Emergency Medical Management. Again, this is a resource for emergency responders. Basically, if there was a radiation emergency, a dirty bomb, or some sort of an accident at a nuclear power plant, then certain things have to happen right away to protect people, to find out what kind of exposure they've had and so forth. And so this tool would allow an emergency responder or a first responder to quickly know what to do. And this next screenshot is just a picture of a triage algorithm that could be used for someone who needed to know what to do for the pediatric population. So this is the triage algorithm for children. Now this one, WISER, is the Wireless System for Emergency Responders. There is a full website that goes along with this with downloadable materials that emergency responders can use if there's a hazardous spill, or some other kind of maybe a leak of a train car that was carrying some sort of pressurized gas or something. And I actually had an opportunity to try this out a couple of weeks ago. I was in my van pool on my way to work, and there was a problem on the highway, on the freeway, on the opposite direction, thank goodness, because they shut down the entire freeway. And we heard on the radio that a swimming pool cleaning company had dropped a big bucket of muriatic acid on the freeway. And this is a really nasty substance that can eat right through concrete. So I thought, and they said they were washing off the freeway, and I thought, I wonder if that's really true. So I pulled out my Android phone, and I pulled up the Wiser app that I had downloaded at some point in the past, and I looked up muriatic acid, and I discovered all kinds of things about it, like what the safe distance is, depending on the amount that's spilled. I found out that you don't use water, and you don't use anything that might cause a spark or a risk of fire or explosion. And I discovered that the best way to clean it up is to put sand or dirt on it and then sweep it up. And so when the radio person said they were washing it down, I bet they were washing it off with sand instead of water. So it was really cool to see how it worked in a real life situation. So that's Wiser. And all of these resources, I should mention, are available for free. If they're from the National Library of Medicine, they are free resources available to anybody who has access to the internet and through their mobile devices. Now we'll go outside of the National Library of Medicine to the USA.gov site, and it's just apps.usa.gov. And here you can search by topic. So if I wanted just health apps, I could search for that. Or you might just want to scroll through and see what's there. There is a wealth of information here and some really, really fun apps. I travel a lot with my job, so I have looked at the MyTSA app, and it's been very helpful, just in knowing what to expect and what I can bring and what I can't bring, that kind of thing. So that would be useful also if things change. So when I'm traveling, I could quickly pull it up and see if there's any new restriction that I need to watch out for or whatever. Here is an example of one of the sites that has been made into a site with mobile content or an app. It's recalls.gov, and it's kind of a neat site. This is the actual website, and it says, when you're buying and using products, safety comes first. And down below it says, whether you're at your child's daycare center or a yard sale, whether you're at a store at home, now you can type a product's name into your phone and learn immediately whether that product has been recalled because of a safety concern. When I worked in public libraries, we got questions about this kind of thing on a pretty regular basis. People wanted to know if there was a recall, if there was some sort of system where they could complain about a problem with a product, that sort of thing. So that's one of the reasons I wanted to point this one out. It is a mobile app that you can download with this, and right on the page it tells you, where to go to get that mobile app. So just one that I'm pointing out, and there are many, many others. Here is the, when you click on that link for downloading it, you can see that in this particular case, there is only an Android app. Or when I took this screenshot, there was only an Android app. I don't know if there's one available for the iPad and the iPhone yet, but it's also available as a mobile website. So either way, you'd be able to get to it. This is a site that I want to point out. It's not from NLM, but it is from a government organization. The Veterans Administration now has a really good section on their website on managing post-traumatic stress disorder, and they've created this app for the iPhone called PTSD Coach, and it's really excellent. And you can just see by looking at the screenshot here that it's well designed, easy to use. Once you get into these different sections, it's just a really nice app. And so I'm pointing it out as not only as an example of how good design is happening on these apps, but also really good resource for people who are in need of this kind of app for their own health and wellness. So now I'd like to talk a little bit about some of the health apps, sites, and services that are outside of the .gov domain, because there is just so much out there, some good, some bad, and it's very hard to recommend anything right now because this whole landscape is changing day by day. There are apps and sites for just about everything you can imagine, from using them as a reference tool for tracking your health and fitness progress, if you were dieting, if you were on a running schedule, maybe training for some sort of a running event, a marathon, or some other kind of event. Reminders to take medication whenever you need to, and sharing information with other people. It is just changing all the time, and the quality goes up and down. So we'll talk about how to evaluate that. Here's one that I'd like to point out. Now, this is not an app and it's not a website, but what it is a service that people can sign up for using their cell phone. And it's a great resource. There are lots of apps and sites that help people with this kind of information, but what's nice about this one is there's a partnership of a bunch of organizations, including cell phone providers, wireless service providers, who have gotten together and agreed to make this a free service to everybody. And it's available in English and Spanish. So even if a person has a phone that has a text data plan where they have to pay for text messages, then the text messages that come from this service are free, regardless of what your plan is. And so that's a really nice service, and it shows that a lot of the wireless providers are doing good things for the public good. This service is when a person signs up for it, they are texted a question about when their baby is due. And then messages come that are targeted to the time period during the pregnancy. So as the woman gets closer to her delivery date, then those messages are more relevant to labor and delivery and that kind of thing. This continues for up to a full year after the baby is born, with messages about caring for the baby, what to expect with the first doctor visit, all of those kinds of things. So it's a really wonderful service. And just wanted to show that as an example. In English and Spanish also. So this is a screenshot of an iPad as I was looking at some of the apps that were out there. I started just searching for things that I was interested in or that I thought might be useful, and I've picked a couple to show you. On this screen, we have all kinds of little apps that range from fitness tracking to recipe building, for medication reminders, and keeping track of your weight and your blood pressure and all kinds of things. There's even one to track treatments, like if somebody is having chemotherapy, then they can track their treatments there. And what it really is, it's like having your own personal trainer in your pocket. Some of the apps will help people, for fitness and workouts. The apps can help people just track all kinds of things, including your weightlifting regime, and to see if you're increasing or not increasing. One that I really like, although I haven't gotten to my 100 push-ups yet, I doubt if I ever will. It's a fun app that allows you to do a little test to see where you are fitness-wise, and how many push-ups you can actually do, and then you set your goal, and it sets up a training plan for you, how many push-ups you would do to reach that final goal. Maybe it would be 50 or 75 or 100. So that's the kind of thing. Now, there are also websites that you can access that are the same, but if you want it on your phone, you can do that. I've listed a couple of others here that I'm familiar with. SportyPal, which is a way that you can tie in with the GPS feature on your phone to the walks, runs, hikes, or bike rides that you do. So basically you turn it on, it engages the GPS, and then when your event is done, whether it's a hike or a run or whatever, then it will show you the map and how long it took you to do it and some of the other statistics that are available. You can see the elevation gain, and it's really cool. So that's a way to track. And you can also publish your workout to the website so you can share it with friends and so forth. As far as diet and activity tracking, there are so many tools out there. I'm not really recommending any of these. These are examples of the kinds of things you can find, but they kind of give you an idea of what's out there. Weight Watchers has a couple of offerings. There's Weight Watchers Mobile, and then there is an app. And what they have done, their model is that they provide a little bit of free content, but if you're an actual Weight Watchers member, then you have access to all of the content. So it's just a kind of a teaser, and in some cases, maybe it would even prompt someone to join Weight Watchers as a way to get at that content. MyFitnessPal is a very robust site. It's a website and also a free application for your, it's available on iPhone, iPad, Android phones. It allows you to set fitness and diet goals, track your calories. You can enter in your own exercises or choose from a database of exercises. It's very full-featured. You can build your own favorite food databases or choose from the database there. And then this adds an element where you can also share your information either with everybody on MyFitnessPal, or if you have a buddy, maybe you have someone that you want to share your workouts with, and you're going down this diet and fitness path together with a friend, then you can share your information just with one or a few people. So it's kind of a nice site that way. And this is just an example of the kinds of things you can do with these apps and the complementary websites. Livestrong, some of you may be familiar with My Daily Plate. There is a free and pay version of this, and then there are just many, many others. So for health and medical, we have medication reminders, as I mentioned, blood pressure trackers, all kinds of things. If you have some sort of a condition and you need to keep a journal for the doctor to find out what your triggers are, there are apps for all of those different kinds of conditions. There are even first aid references for people and for pets, or for managing the information about your pet's vet care. Here's an example of one I found for diabetics, and it's a way that you can track your glucose levels. And you'll notice in the lower right hand, there's that the slot machine kind of format again. Similar type of format on some of these applications. And I found one also for diabetics, but for diabetic kids. This one comes from Medtronic, which is a company that makes medical devices, infusion pumps, and things like that for diabetics, and for other kinds of conditions also. But this is called Carb Counting with Lenny the Lion, and it's a really fun, colorful, easy-to-use app for kids to help them sort of manage their carb intake and to understand what kinds of foods have more carbs and just how to do that. So really neat stuff that's out there that are kid-friendly and also from more reliable resources. And you don't see any ads for Medtronic products in this app. They've just done it as a way to help patients, manage their diabetes. That's not always the case, but in this case it is. So in this slide, I'd like to find out from you if you want to respond. Use the chat box to share any good apps that you use. If you have some that you really, really like, share with us. I know everybody would appreciate it. So I have a few of my own personal favorites, and I've mentioned a couple of them, and but they're just my own favorites. I'm sure you might have some too. But I do want to point out, many of these tools you don't need a mobile device for. The one I mentioned earlier, MyFitnessPal, it's a website, so you can actually use it completely just on your computer with internet access, and you never have to download the app. So keep in mind that there are those sites out there. So this is kind of a slide that it's for anybody who has a mobile device, you already know this. If you don't have a mobile device, then you may need to know. But if you are looking for apps for a particular operating system, the Android phones all use the same operating system, and on any Android phone, it's going to have a link to the Android Marketplace. There is another place now, there are several, but another one that I can recommend is the Amazon App Store. And the interface is a little bit easier to use. You can actually go on the web, look at the App Store, and then you just go to Amazon.com and search for App Store, and it will bring up the list of all the apps that are currently available for Android. So not all, but a good selection of them. So that's a good way. With Apple products, you're going to go to the iTunes Store primarily. And then Macworld is a magazine that's been around for a long time and a website, and they also have an app guide. For any of you that have BlackBerry phones, then you would know that you would go to the BlackBerry App World site. And so over in the chat box, we have some activity over there. And we have one that is Bike Tracks app to track your bike ride. Tap and Track counts calories for whatever you eat. That sounds great. Mel app, take a pic of suspected skin cancer and find out if it's really skin cancer. I need to check that one because in my youth, before I knew any better, I had many, many sunburns, and I'm always concerned about my risk of skin cancer, which is very high. So I'll check that one out. And what about HP tablets? With your tablets, you're going to be looking mostly for mobile sites. I don't know offhand of apps that are available for tablets because they're kind of PC based. So I think your best bet is going to be looking for the mobile sites rather than apps. And if anybody has any information on that, please put it in the chat box because I'm not sure. And then we have Walk, Jog, Run, and I've heard really good things about that too. So it uses Google Maps. So great, thank you for all of those, and please continue to add if you have others. So now we're moving into the evaluation part. Should you download that app? How do you know if it's safe for your phone? Well, you need to evaluate, and some of the ways you do that is just by looking if there's a track record. What are the users saying about it? If they're saying, hey, it always crashes my phone, it's a lousy app, it doesn't allow you to do anything, just look for another one. That's a good way. See if the developer has a website. Check it out and just use your common sense. Use the criteria that you would in evaluating any kind of website. And how much does it cost? Is it free or is there a fee for it? If you can try a free version or a free trial, that's much better than paying for something up front if you don't know how it's going to work. And is it unique? Is it something that that really would make a difference if it were on your phone? Or is it something that's just kind of a fun, silly thing that you want? Maybe you do want that, but maybe it's not so unique. And so I kind of have to filter how much I'm going to put on my phone. Even though it might be fun, it might not be anything more than a time waster for me. So to kind of go over these again, if you can find out whether or not the developer is trustworthy just by kind of reviewing the website, look at the user reviews, and you can find these in iTunes, the Android Marketplace, and then other places like PC World, Macworld, CNET, and other review sites. Think about the content. Is it appropriate? Current, accurate, non-biased, that sort of thing. Are there advertisements? Maybe you get the free thing if you're willing to look at the ads. Maybe that's not such a bad thing. That's how they often will pay for developing the app. And the cost. Is it worth it for the 99 cents or the $2.99? So just to give us a real-world example of evaluation, I'm personally interested in sports nutrition. So I found this app and I thought, oh, this looks interesting. So I read the description and it says you're about to uncover what the #1 key is to sports nutrition, exactly what sports nutrition is and how it can help you. And then it says, no matter how much time you have had to prepare. And I thought, that's kind of an odd thing to say, but let's go a little bit closer and see what else it has to say. So more apps by the same developer, 101 crockpot recipes, acne tips, and how to pick up girls, the Bible. Okay, so that tells me right away that maybe this developer isn't completely about sports nutrition or good quality health information. And customer ratings. We have not received enough ratings to display an average. It's 99 cents. And so I thought, well, all right, I'll follow my own advice and I'll look at the developer website. So when I go to the website, there's a blog posting, and it was posted on March 6, 2010. That's the most recent posting, so it's kind of dated. And it's called Lemon Cures. And one of the things I read a little bit, and then it says, lemon juice is one of the most popular drinks in the world as it is very healthy, tasty, and low cost. So that's funny. And then it also says you can cure the following diseases with lemon, including high cholesterol, high blood pressure, all kinds of other things. So I realized these guys are a flake. And then I realized they're just cranking out these apps at 99 cents a piece, and they're probably getting some purchases from it. So one last thing here about evaluating. There were some developers that published a couple of apps, one in the Android marketplace and one in iTunes, and they said that their app would cure acne by holding the phone. It would emit these little lights. If you held it close to the acne, it would cure the acne. And they got slammed with cease and desist, and they had to stop making the claims. They were fined a lot of money. And the funniest thing was the comment that was made by the FTC chairman, who said, unfortunately, when it comes to curing acne, there's no app for that. So this is a great example. Now, just one additional thing. It turns out that those apps were downloaded so many times. From the iTunes store, 11,600 downloads for $1.99. So that just gives you an example of how people are making money selling bad apps. So be careful out there. Here's just a quick example of the PC World app guide. So you can do all kinds of looking here and see, sort by the user ratings. You can get a lot of ideas, and it's a good discovery tool. There are many others like it, but I'm just showing this as an example. So now the last part of the webinar is going to go into how people are using social sites for health information. And in the chat box, I'd like you to mention an answer to the following question. Would you feel comfortable recommending a health-related social networking site, such as Patients Like Me, to a library user? And I'd like to hear yes or no, and if you feel so inclined, to say why. This would be, for social support, for sharing information about their health condition. And I'll go ahead on to the next slide, but you can go ahead and type in your answer if you're so inclined. And I'd like you to think about this quote. Unfortunately, my font size was too big, so you can't see who said this, but the quote is, "Who then can so softly bind up the wound of another as he who has felt the same wound himself?" And that was in a letter to a friend by Thomas Jefferson. And he was talking about, who is able to make recommendations about how to do something related with your health. I mean, it's really the whole notion of, are ordinary people qualified to give advice to another person about their health condition? And maybe the answer is yes. Maybe the answer is no. I think there are some cases where just being able to talk to somebody else who has a similar condition is a good thing. So let's see what's coming into the chat box. So we have someone, if the patron was looking for a network that could offer them support, that's exactly what's happening. Many people are isolated and they're not able to or maybe not inclined to go to a in-person support group. Then we also have the expected answers too. Don't want to be responsible for giving false or incorrect info. And you see that a lot on these discussion boards. There is a lot of false or incorrect information that's floating around. You know, a lot of recommendations for herbal supplements or for this treatment or that treatment. And, you know, so it's really kind of a, you know, a can of worms out there. And then another one, don't know enough about social networking sites. That's kind of the safe thing. If you're not sure, of course, you wouldn't be able to recommend and need more information. So thank you for responding to that. So here's what's really happening. Regardless of how we feel about these sites, as librarians, we always want to give valid, authoritative information. But whether we like it or not, people are using these sites to share their information about their own conditions. It is also a group support system. The benefits really are that sometimes they can get information about treatments that they don't have access to otherwise. Maybe their physician isn't an expert on this area, and they just have, it opens up a whole lot of doors. Of course, the caveats are there are privacy issues. You know, once you put it out there, it's out there. And so it may not be such a good idea unless there are very tight privacy restrictions on the site, and people have to be very, very careful. There are also sites where people can share information. Let's say that, you know, one of my family members has you know, is scheduled for a major operation, and they're going to be in the hospital for a little while. But all of our friends and family want to know what's happening, and so there are sites where you can set up a private website, invite your friends and family, and you can give updates on the patient's status, and also other people can send in, you know, well-wishing sentiments and things like that. So that's a different type of a thing. So patients like me, if you don't know about this, there is really a reason to look. I think that some people will find this site very important, and other people will dismiss it. But I think that it's a good idea for all librarians to take a look at a site like this, read how it was founded. There's a video that you can see on how this came to be, and it gives you a really good understanding of what these social sites are like. And it may actually change your mind a little bit about when these sites are appropriate and when they're not. And so I really encourage you to take a look and then make your own decision. Here are a couple more, and I have to admit I have not personally used any of these sites. So what I would recommend is that if you have patrons or library users who are wanting information like this, go in and take a look and kind of, I mean, our responsibility is to help them understand they need to look at the privacy policy and know whether or not it's appropriate for them. Here are some sites for sharing the patient updates. There are many more that are out there. But here are two that I've looked at these in a little more detail. Caring Bridge, and this is a quote right from the website, free, personal, and private websites that connect people experiencing a health challenge with family and friends. And then Lots of Helping Hands is a way to ask for help from friends. So when there's a health crisis in a family, you know, everyone is always saying, what can I do to help? What can I do? And it's very hard as a person who might be in a position to say, here's what you can do to help. This website actually allows you to organize all of the different kinds of help you might need. Maybe it's childcare, maybe it's, you know, bringing over a meal or something. Anyway, it's something to check out. I wanted to mention there was a question that came in about WebMD and the app for WebMD, and I'm in a position really of recommending the authoritative sites like medlineplus.gov and so forth. And I have not looked at the WebMD app, but I can say with WebMD, the website, is that WebMD is a commercial website which is sponsored by advertising, and they have a lot of corporations and pharmaceutical companies that do provide support for the website. So if a patron goes to WebMD, then they will be exposed to a lot of ads and sponsored content. So my inclination is to usually try to steer people away from any website that provides a lot of advertising and sponsored content, because the patient or the library user might not be savvy enough to steer clear of all of that. Sometimes it's very cleverly designed and it looks like good health information, but it's actually sponsored content that's going to take them to information about a drug treatment. So my recommendation is to try to steer away from the commercial websites where there really is an agenda to get you to click on ads. So that's I think that the information that's there, the actual health information, is good. It sometimes is limited, and you would just have to look at it to see if it's valuable or not. But I would steer towards more the authoritative sites from NIH.gov or medlineplus.gov as my first choice. So here on this slide, what is the librarian's responsibility? If a person is requesting information, about social health networking, I think that really, you can share in the chat box if you'd like, but I think really our responsibility is to just inform the patient that there may be privacy issues and that they need to be really careful about the kinds of things they're posting. They are excellent support systems, and even some of the authoritative sites like the American Cancer Society, there are places within that website where people can connect with others who have had a cancer diagnosis, as an example. So some of the authoritative sites are starting to go into the social sharing of information because they've realized how important it is. Thank you for that tip about CaringBridge. It seems like an excellent site. So to kind of wrap up, tips for library staff: know your own collection. Typically, the e-book content has always been fiction, but now there are some great nonfiction health titles that are coming out. Know the reliable authoritative sites and then their mobile counterparts. Stay current. Try to keep up with all these new mobile devices and the trends. And educate your users as they are asking you about sites. If you see them with a smartphone in their hand, let them know that there may be some sites that would be of interest to them. And these are also on your handout, the gallery, the USA Apps Directory, and then one last final plug for the National Network of Libraries of Medicine regional blogs, because we're always pointing out new technologies, and it's a great way to keep track of what's happening. So last slide, it's 1 o'clock. To-do list. Just go out there and explore and have fun doing it. And then if there are any questions, my email address is here. You can always contact me anytime. And that's it for my presentation today. Thank you so much.